Folks, thanks for joining us today. My name's Sean Dubas with Premier Marketing, and we'll be spending the next 50 to 60 minutes or so discussing what we see as a great opportunity for folks in the Medicare arena to capture a solid part of the market that may not be addressed by our other programs that are part of our portfolio in more of a traditional product, such as a Medicare supplement plan or a regular Medicare Advantage program. We're discussing today Lasso, which is one of the Medicare savings account. That's the preeminent player in the market. And we'll be going through different details concerning that program. We have a special guest speaker with us here today, and today's presentation is being recorded, so you are able to go back and reference this as well. Once the recording uploads, it will be made available on our website at premiersmi.com and on our YouTube channel. And your contact within our organization, your agent success manager with Premier, will have this for you as well. You'll notice in the software package that there is a section for both questions and chat. We ask that you put your questions in the questions box. We find that we normally address those through the course of the presentation, but we will check to make certain that we deliver the information you need to get full return on the investment of the time that you spend with us today. The presentation will be looked at with a different view depending upon your experience in the market. And I'm saying that simply because we have an array of agents that are new to our organizations and to the product itself. And we have some people that have different varying levels of experience. So bear with us as we go through and level set some different things that can make a difference for you in the understanding of these programs. And with that in mind, what we'll do is we'll start with a level set of who Premier is. We're a national marketing organization founded in 1968 that's part of the Integrity Marketing Platform. We're licensed in all 50 states. We act as an insurance wholesaler working through and with independent insurance agents such as yourself, and we do so with contracts that are at the highest possible commission levels, with recruiting contracts available to those who qualify. We do so through a full portfolio of products targeting our favored demographic. So that lays out the different basic Medicare programs when it comes to health insurance coverage, including Medicare Advantage and Medicare supplement plans and standalone Part D prescription drug programs. We also offer a full portfolio of life insurance and annuity products, including final expense life insurance and pre-need plans, long and short-term care programs, disability income plans, and those ancillary programs that address specific needs of our target audience. Those programs go into the different Medicare Advantage programs, including the national carriers and many of the strong regionals that can make a difference for you in your market, with that same philosophy carrying over into the standalone prescription drug plans, where generally these come as part of your contract with the associated MA carrier, Medicare Advantage carrier. A couple of exceptions. Mutual of Omaha is a separate contract from their MedSups or other programs that they offer, and Clever RX is a discount program and not a Part D prescription drug plan. When we look at Medicare supplements, there's an array of programs available to you. The national players are there, and we have different support programs to help you be successful in that space as well. We look at those different ancillary programs. In each of those categories, those leaders are there for you. We make certain we offer these for a number of reasons. One, we want to address the need first and foremost of our prospects and clients, but it also gives us the opportunity to market in a different fashion. These are not subject to some of the same oversight that the other programs that are more carefully regulated are, but they also give us an additional opportunity for additional income streams for ourselves and our agencies. We want to make certain that whatever program that we're speaking of, we're able to properly communicate with our target audience. So we make available off the CMS website an acronym guide. And you'll see that this screenshot from CMS.gov, it lists 4,420 acronyms. So there's a whole bunch of MIC, KEY, MOUSE things out there that we need to be able to translate and make certain that our audiences understand the benefits of the programs we're offering, and this enables us to do so properly. When we look at the Medicare market overall, of course, we're talking about a huge portion of our population, and you hear of the aging of the baby boomers, the silver tsunami, the one every 10 seconds, 10,000 plus a day. And if you look at things based on age, wow, it's a near exponential growth as the baby boomers age into it. But what we're seeing as well is that may not be a totally accurate number, because many of the folks, an increasing percentage anyway, are delaying full access to their Medicare benefits for one reason or another. The pandemic has changed a lot of retirement programs and what monies were there and what aren't. For those of us in the tail end of the baby boomers, we don't get full Social Security until we're 67. Whatever the reason is as to how that tempers that number, it's more than made up by the fact that, gee, a good percentage of folks on Medicare are under the age of 65 accessing benefits because of a disability, and we want to make certain that we're able to address needs no matter how people or why people are accessing Medicare benefits, because it's that's a huge number, 65 million plus in Medicare. How are we going to address the specific needs? And we need to keep in mind that there's no one answer that's correct for everyone, because folks have choices. They don't have to do anything when they come on Medicare. They can even decline Part B, and in some cases that's the right choice if they have other coverage that's credible. And there are some folks that just choose to self-insure for the shortfall in the financial coverage with traditional Medicare, maybe pick up that standalone Part D program to help with the cost of medications, or they'll go the route with traditional standardized, modernized med subs, or bundle into a Medicare Advantage plan. In any choice that a person has, we want to make certain that we have programs that address their needs. And today's topic is unique because we're looking at things from a slightly different angle, and we'll defer those details to our guest speaker in just a wee bit. Why do we talk about this now when we're past the open enrollment period? Well, Kaiser Family Foundation tells us that, well, a whole bunch of people on Medicare aren't looking at their programs year over year, and it may be costing them to not do so. And it doesn't matter what type of base coverage they have. We're not doing a year-to-year plan comparison as a Medicare beneficiary as perhaps we should. And folks aren't using the detail that's out there for the folks to access information from the government, be it whatever means. Are they reading through their Medicare and U book that's sent to them electronically or by the Postal Service? Are they accessing things through an app that's available to them? Are they going online and looking at different pieces of information that can help them with their decision-making process? Probably not, if 70% of them aren't even looking on an annual basis. So we want to make certain that we're able to deliver information in the fashion that folks can best digest it. Sometimes that means we have to visit face-to-face across the kitchen table, shake hands, kiss babies, whatever it takes. Some folks, particularly that are newer into Medicare, do shopping ahead of time. They want a virtual experience, and sometimes it's a hybrid situation. And we're seeing an increased number of folks on Medicare that prefer some things digitally, and they're being trained to do so because, hey, that's life in the big city, so to speak, over the last few years. The pandemic changed even how we access care, where appointments are handled virtually with a primary care specialist. A lot of the prelim work for hospitals and dentists are handled in that fashion. Other facets of our life have trained us to do some things electronically. Celebrations of faith online. This gives us, however, the opportunity to work with organizations that are able to deliver things in that fashion, enables us as insurance agents to more properly manage our most valuable resource, our time, because it can cut down that windshield time, other pieces that well, kind of mess with our schedule. Let's put it that way. And this gives us the opportunity to reach more people and do some things thoroughly, systematically, and compliantly. So we're going to roll through that because some of these election periods that I kind of referenced a little bit ago with the Kaiser Family Foundation, well, they don't always apply. It's not a solid lock-in. And particularly when we look at a Medicare savings program, some different things, it's a different animal in that circumstance. If it wasn't anyway, we still have the SEP charts, the special election periods that we see year over year, the special election periods that we see periodically, and the reminders that we get from different carriers saying, hey, consider this. It gives us that reminder and helps us work throughout the year to deliver information, perform our job, and help the population that we're serving. So what we've done today is invited our friends at Lasso to come over and visit with us about the particular programs that they offer in this area and how it can benefit a good segment of our population. So what we have today as our special guest presenter is Michelle Skenendor. And Skenendor, pardon me, Michelle, if I'm mispronouncing, I have a hard time with my own name sometimes. And what we're doing then is asking her to come in and speak to us about this program. So at this time, I'm going to turn control over to Michelle. Here we go. Let's get Tim's name off of there. I should have changed that there. Michelle, the helm is yours.
Thank you, John. Hi, everyone. And you did say my last name correct. I'm Michelle Skenendor, so good job. Not many people can do that. But I'm super happy to be here today and discuss the Lasso Healthcare MSA with you all. A couple of things. We are part of Zing Health. So if you're not familiar with that, Zing Health is a Medicare Advantage plan that offers products in Illinois, Indiana, and Michigan, and I know Premier is also offering that contract. So some of the sales team is merged here. So Chris Murray, he's our VP of Partner Sales. Myself, I'm the sales manager for Lasso Healthcare. I do all things MSA. And then we also have Jason Harrington, who is our regional broker director for Zing Health. So a little bit about Lasso Healthcare. We were established in 2018. We first launched our medical savings account, or our MSA, back in January 2019, and we're currently in our 5th plan year with an active membership. With that information, we are the nation's leading medical savings account carrier, offering MSAs in more locations and to more members than any other carrier. We do work with third-party administrators who help provide claims processing and rewards processing or for rewards program support. And then on the banking side, we partner with a well-known national banking entity, Optum Financial, and they administer the MSA's banking component. So we've got a really great team that we work with and a lot of really great partners to bring us to the level of success that we are striving for. So here's a real a look at where we've been and where we've got where we're going. Again, we were established in 2018. We first launched the MSA into 17 states. And since then, we have more than doubled our service area over the years. We do have a goal of continued expansion and are looking to be in all 50 states here at some point in time. So we're really excited with that and bringing this product to everyone where it's really been just a regional product in the past. So many of you may be thinking, why the MSA? What makes it so special? Why am I sitting here listening to this person talk about a product that, yeah, I've heard a little bit about maybe in an AHIP exam or that over the past few years, but why now? So over the past 15 years, there has been strong historical growth of health savings accounts, or HSAs, which is the MSA's commercial side equivalent. And when we say growth, we are talking millions. Specifically, HSAs have grown from 4.5 million accounts in 2007 to over 30 million accounts at the end of 2020. Now, when you take those numbers and you add in the thousands of individuals who are aging into Medicare each day, like John mentioned, many of them are familiar with the HSA. So it makes sense that that demand for a comparable product within the Medicare market is greater now than it has ever been before. And the MSA is the only product that's going to come close to what those individuals are hoping to find. So what exactly is an MSA? Well, there's many types of Medicare options available out there. You've got original Medicare, Medicare supplements, Medicare Advantage. The MSA is one of several different types of Medicare Advantage plans. MSAs have two pieces. There is the high deductible health plan, and it is paired with a tax advantage savings account. And the savings account is an important part of the MSA's overall value. So when speaking about the operation of an MSA and how it works, it's pretty straightforward. First, there's a deposit. So we deposit money received from Medicare into the member's medical savings account, which they opened during enrollment. The member then decides how to spend, save, or invest those funds. So no one can control what a member does with their money once it's in their medical savings account. It's theirs, it's their decision to use it as they wish, but we do have recommendations on how they can best use those funds to get the most value from the MSA plan, and we'll cover that here in a little bit. It is a high deductible plan, so 100% of the services received below the plan deductible are the member's responsibility. Once the member meets the plan deductible, we cover 100% of the Medicare Part A and Part B costs going forward. So it's a very clean process. Everything below the deductible will fall to the member, and all Medicare items above the deductible fall to Lasso Healthcare. Any funds remaining at the end of the year roll over. So it's not a use it or lose it proposition. Even if they leave the plan, the member is going to take the remaining amount with them for continued tax-free use on qualified medical expenses. Now, when we look at joining an MSA compared to other Medicare Advantage plans, there are going to be some differences. Not everything here is specific to the MSA, but I will call out those that are. So first off, they must be Medicare eligible. They must live in the Lasso Healthcare MSA service area. They must reside in the US for 183 days or more during the calendar year. They're not allowed to have other coverage that would cover their MSA plan deductible. So this is going to be any benefits that you would find under an employer or union group, TRICARE, veteran benefits, or your federal employee health benefit plan. Now, I do want to point out specifically VA benefits with this one because I do get a lot of agents that really think this is a fantastic plan for their veteran clients because they're getting their drug coverage from the VA, but they really don't use their health coverage. Unfortunately, though, the VA has no way to separate those two pieces. So if they're receiving drug benefits, that does make them eligible for the health benefits, and that excludes them from MSA eligibility. So this is not going to be something that you want to bring to your VA client, your veteran clients. They cannot currently be eligible for Medicaid, and they cannot currently be receiving Medicare hospice benefits. So as long as they meet these 6 criteria, and then they also have a valid enrollment period, they should be able to join the MSA. Now let's review some of the unique features that come with the MSA. First, MSAs are the only Medicare Advantage plan that gives the member money. So this is done each year they're a member through that deposit. We have a $0 premium, and that is by law. We are not allowed to charge a monthly premium. So that's going to be a huge cost savings for those individuals. We have no network. So MSA members have access to any Medicare provider who agrees to see them with no referral or prior authorization required. We are a true Medicare Advantage only plan, so there's no Part D coverage that comes with this plan. So that's going to open it up and give you that ability to mix and match that coverage that's going to best fit your client's needs. It's also going to give you that opportunity to earn a little bit more commission for that product from that other carrier. MSA funds can be used tax-free on all IRS-deemed qualified medical expenses, even those that are not otherwise covered by Medicare. So we'll get into that a little bit as well. Now, if you're sitting there thinking like who in your current client base this would be a good product for, because there's so many unique characteristics, it's actually very valuable to many different types of Medicare beneficiaries. We have split it up into 5 main categories where we see a lot of success. First off, travelers and snowbirds, they're going to be drawn to the MSA because of the broad access. Their healthcare isn't restricted to a network of providers, which is going to offer them more flexibility. Now, I do want to point out that when we say travel, we do mean traveling within the US and any islands considered part of the US. This is not an ideal product for foreign travel because we do follow the guidelines of original Medicare. Next here, HSA fans. So if someone has an HSA balance, they're moving into the Medicare space, the MSA is a perfect landing zone for them. They're going to understand it more, plus they can use their HSA funds to help cover their member responsibility portion of the MSA. Now, if they're working with a financial advisor, they're going to be able to identify even more ways to strategically use both their MSA funds and their HSA funds for a greater amount of tax savings. People with in-control chronic conditions, the claims data that we've seen over the past couple of years really does support that the MSA can be a good choice for those who have some in-control chronic conditions, assuming that number is limited. So if your client has high blood pressure, diabetes, high cholesterol, as long as they're receiving regular care and they continue to take their required medications, they can do extremely well in the MSA and end the year with funds left in their account because that's where that value is for them. Health enthusiasts, enrolling in the MSA should really be an easy choice for this group. Their provider visits are most likely going to be limited to preventive care, which is going to allow them to grow their account more rapidly and really create a medical nest egg. So for down the road, let's say their health takes a turn in a different direction, they have those funds sitting there that they can use at that point towards their medical bills, and it's going to help them out. MedSup enrollees, anyone who is currently enrolled in a Medicare supplement and tired of paying premiums, maybe they're just now turning 65 or just enrolling into Medicare and they are thinking about a Medicare supplement because it's got that broad access, the MSA is a great alternate option for them. They're going to still have that broad access with no network, but they're going to have that cost savings with a $0 premium, which is going to save them a substantial amount of money. And I do have some slides here at towards the end that we're going to cover the value proposition between Medicare supplement and then the MSA. So a couple of other vital components of the MSA are related to enrollment and disenrollment periods. Compared to other Medicare Advantage plans, there are limited opportunities to get in and out of the MSA. Generally speaking, enrollment can occur in only 2 instances, so that's during AEP, so October 15th through December 7th, or during someone's ICEP. Now, the ICEP can actually be a couple different times. It can be if they're under 65 and they qualify for Medicare due to disability, if they're turning 65 and they're newly eligible for Medicare, or let's say they continued to work and they deferred their Part B and now they are retiring and enrolling into Part B. That ICEP window is the 3 months prior to their Part B effective date. Now, disenrollment can occur during AEP, but then is also limited to a set of 5 SEP circumstances. And that's going to be if they have a permanent move out of the service area, if they gain Medicaid eligibility, if they gain other coverage that would duplicate their Medicare Part A or Part B services, if there's a 5-star Medicare Advantage plan in their county, or the trial period. And it's specifically the trial period for those who left a Medicare supplement to enroll in a Medicare Advantage plan for the first time. These individuals can disenroll from the MSA any time within the first 12 months to go back to original Medicare. There are no other SEP disenrollments allowed. There's absolutely no SEP enrollments allowed. Also, you'll notice I didn't mention OEP. So even though OEP is a Medicare Advantage open enrollment period and the MSA is a type of Medicare Advantage plan, CMS strictly prohibits any movement in or out of the MSA during that time frame. So that's a really important thing to know, especially if you're writing AEP business. You don't want to give your clients that hope of that possibility that they can change plans come January through March, because that is not the case, not with this plan. Now, you're probably wondering why. Why are there so many extra restrictions when it comes to the MSA compared to other Medicare Advantage plans? And it all comes down to the banking component that comes with the MSA. So here we have some information on how mid-year enrollment and disenrollment works. If your client enrolls for a January 1st effective date, they're going to receive that full deposit, and they're also going to be responsible for that full deductible for the plan they've chosen. However, if someone's enrolling during their ICEP window, both that deposit and the deductible are prorated based on the number of months that they would have been enrolled with the plan. So the slide here shows an example of an enrollment effective April 1st. This individual is going to receive a 9-month prorated deposit and is also going to be responsible for a 9-month prorated deductible. Although the deposit and the deductible amounts vary for enrollment, the member responsibility is always going to remain the same. So that's the one constant you can definitely bet on. Now, we never expect an agent to know what those prorated amounts are. There's math that's involved, and sometimes that's just too much. So we do have the amounts listed out on our website, lassohealthcare.com/learn, so on the Learn page. And you can go out there and you can see the exact prorated amounts for the plan you've decided or your clients decided based on the month. So it's really easy. You can just go out there and easily identify those amounts. Now, when there is a mid-year disenrollment where the member meets one of the limited SEPs, or let's say they pass away because death is also considered a form of disenrollment, that member will owe back any unearned deposit funds to the health plan. And that's because CMS pulls them back from us. So the example again on the slide shows a disenrollment effective July 1st. This individual is going to owe back a 6-month prorated amount of the current year's deposit only to Lasso Healthcare, and then they will be responsible for that full year deductible. The deductible is not prorated when someone's disenrolling. If they remain a member through the entire year, so they go through December 1st, any funds remaining in their account at the end of that time frame are theirs. It's 100% theirs to keep. We will never be able to pull them back for them. So if they remain in the plan, they're going to get a new deposit added to those funds, and that's how they're going to build that account up. If they leave the plan and go to another Medicare Advantage plan or back to original Medicare and get into a Medicare supplement plan, those funds are theirs. They can continue to use them tax-free on any qualified medical expense. So as mentioned earlier, Optum Financial is our chosen banking partner for the medical savings account. So when the Medicare beneficiary opens or when they enroll into the health plan, they actually complete 2 different applications. They're completing an application to enroll with Lasso Healthcare, but then they're also completing an application to open a medical savings account with Optum Financial. Once the account is opened, the funds are going to be deposited and available in that account on the effective date. The only difference there is if the effective date falls on a banking holiday, then it's the next day. But as soon as that deposit's available, they're going to be free to move those funds tax-free to a financial institution of their choice, as long as the funds are moved to another medical savings account. So MSA funds cannot be commingled with any other funds or placed in an account under someone else's name without tax repercussion. Members do and are encouraged to remain with Optum Financial. They are our banking partner for a reason. You know, we didn't just go out and pick the first one. We did a lot of due diligence. And they've been really great working with us since we launched. There are additional benefits that Optum Financial brings to the member, which we have got listed on here. I'm not going to go through all of them, but I will point out that the member is going to receive a separate welcome kit from Optum Financial that's going to include information on how to set up their online portal, designate a beneficiary, and then the biggest one is they're going to receive a debit card, and that debit card is going to be how they access those MSA funds to pay for any of their QMEs or however they want to use those funds. The other biggest benefit that Optum Financial brings to the table is they allow any member who has a balance over $2,000 in their medical savings account to potentially grow those funds and invest them. So MSA members are not allowed to otherwise contribute directly to the savings account. So this is really the only other way that someone can grow that account up aside from being a continued member year after year and receiving a new deposit. So if you do have some financial savvy clients out there, this is going to be a really great product. It's going to catch their eye because they're going to be able to actually invest these funds too, and those gains, any gains that are earned off of those investments are also tax-free and just go back to the account. So it can be really, really great for someone. Now we come to payment responsibility with the MSA. Earlier, I had mentioned that no one can control how the member spends their MSA funds, but we have recommendations on how they can use them to get the most value. So this graphic here shows 3 different categories a member can essentially itemize their expenses under. You've got Group 1 on the left. These are your Medicare Part A and Part B covered expenses. They are also considered qualified medical expenses, or QMEs, by the IRS. MSA funds can be used tax-free on all of these expenses, and the amounts accrue to lower the plan deductible. So this is the best category someone can use their MSA funds on. If they can be in the MSA and only use their funds to pay for their Medicare covered expenses, that is fantastic and definitely going to bring them the most value. Group 2 here, these are your non-Medicare qualified medical expenses. A few items in this group are going to be your dental, vision, prescription drug copays and deductibles. MSA funds can be used tax-free on these items, but the key difference is that the amounts do not count towards the plan deductible. For a full list of items in this category, you're going to want to reference IRS Publication 502. So if you're not familiar with it, go out there, Google it, save it to your favorites bar. It's a pretty extensive list of items that the member can use these MSA funds on, tax-free. Group 3 here, it's really everything else. It's any item that isn't a Medicare Part A or Part B service or is not a qualified medical expense. These items are subject to ordinary income tax as well as a 50% penalty, and that's a 50. That makes this category the worst one possible to spend MSA funds on. One example most don't realize falls into this category is the use of a member's MSA funds to pay for a spouse's or a dependent's health care. When MSA funds are used to pay for services other than the member, they are then considered non-qualified expenses, and then they're going to be subject to those additional taxes and penalty. So it's really important to educate your client on the different categories here, and just make sure that they're educated enough to spend their funds wisely or however it makes sense for them, but trying to avoid any additional types of penalties or taxes. As mentioned earlier, the MSA does not come with drug benefits, so the member will need to obtain a standalone PDP drug plan. While they can use their MSA funds to pay for copays, coinsurance, and deductibles for their drug plan, it's essential to note that they cannot pay for the premiums associated with that coverage, at least not tax-free. The only premium the MSA funds can be used on tax-free are those tied to long-term care policies. So this graphic does a really great job of showing that. You can easily see that long-term care is the only only coverage that you can use your MSA funds MSA funds tax-free on under premium. Sorry, can't talk there. You can use your MSA funds tax-free on all of your other copays, coinsurance, and deductibles for all of the other common coverages, just not premiums. And we do encourage that the MSA member do purchase some additional ancillary or supplemental benefits, really to round out the coverage. In fact, a hospital indemnity plan is something that pairs really great with this product, especially if someone's new and they're concerned about that high deductible. Just note that the member cannot use their MSA funds to pay for any of those premiums tax-free. And that does include the Medicare Part B premium as well. Now let's talk a little bit about clinical access with the MSA. Lasso Healthcare does not have a network of providers, which gives the member access to choose their healthcare services and their providers as they wish. Ultimately, the MSA member can see any provider that agrees to see them, and selecting a Medicare participating provider is going to bring them the most value. So when a member goes to a Medicare participating provider, they're going to pay the lesser of the billed charges, or 100% of the Medicare rate, and all of those Medicare covered costs are going to count towards the deductible. If a member were to go to a non-participating provider, they're going to pay the same as par, but they're also going to be responsible for any balance bill charges or limiting charges where allowed by state law. And that's typically an additional 15% that's added to that Medicare amount. Excess charges are not reimbursed by the health plan, and they do not count towards the deductible. If a member were to see a provider that opts out of Medicare completely, there's going to be a private contract between the provider and the patient. Medicare does not limit the billings, charges do not count towards the plan deductible, and they're not reimbursed by the health plan. So the providers in this category are going to likely skew on the specialty dentist side or specialty mental health providers. Now, it is important to note that providers can decide at every visit whether or not to accept the MSA plan and agree to treat the member. Except for in emergencies, members cannot be denied emergency care due to their insurance plan. With that said, we have thousands of providers who have accepted the MSA, including some of the largest and most renowned health systems out there. So this really shouldn't be a concern. We do encourage, though, members to reach out to their provider in advance just to, make sure that they are aware that they're on the MSA plan, and let them know, because this is not just a new product for you as an agent. It's not a new product for your client. This is a new product in a lot of our markets. It's really been regionally available over the years. So we're the first carrier that's really bringing it out onto a national level. So it does make sense that there are providers out there who just aren't familiar with it yet and don't necessarily understand it or how it works. And if that's the case, we do have a team who is very, very good and versed with speaking with the providers and giving them that additional education, so they'll work with us and treat the member. And that provider number is actually can be found on the backside of the Lasso Healthcare ID card. It's on our provider guide. It's on a provider card. And realistically, it's just member services. So they just need to call member services and speak with our provider team. So here we're going to take a quick look at our rewards program. This is a benefit that is specific to Lasso Healthcare that helps beneficiaries with some of the preventive care that they would receive as an MSA member. Another nuance of the MSA is, by law, we cannot cover $0 preventive care. So unlike other MA plans or even original Medicare, the member is going to be responsible for these services if they have not yet met their deductible. So knowing this, we didn't want to see members choose against receiving preventive care because they'd have to pay for those costs. So we created this rewards program where the member can enjoy extra perks beyond their deposit by completing 3 activities. So the activities that are listed are conducting an annual wellness visit, completing a health survey, and then ordering labs and discussing results. Now, I do want to point out that These are the 2022 reward benefits. Our 2023 benefits are being enhanced and are going to change just slightly. And that information is supposed to be ready and coming out to everyone in the beginning of February. So I can't say specifics right now. I will say that we're going to definitely put more of an emphasis on the annual wellness visit and the health survey and increase those rewards, and then just make the program a little bit more useful for the member. Once they do an activity, though, it's completely optional for them. They can pick one activity, they can pick two, they can do three, they can do any of them in any order. But once they complete their activity, they submit that form to us, and our partner Nations Benefits will process their reward via a reloadable rewards card. So that member is going to receive that card and then be able to use those funds to make purchases at really any drug or grocery store, and even more places for 2023. And it's really, they can kind of treat it a little bit like an OTC card as far as what they can use the funds for. But it's just another way that we can give back to our members. Here is a look at our service area map for 2023. So the Lasso Healthcare MSA is available in every county across 35 states plus the District of Columbia. So this is really, really great, especially for agents who cross-sell in across multiple different areas. We are in every county, so there's no question of, where does my client live? What county are they in? What plans are they in? Is this plan available? If it's in the state, we are, or if they're in the state of Texas or anywhere that is listed in the dark area here, we are available. Now, it's a little too early to share specifics just yet, but we are looking to add to this calendar for 2024. So you'll expect to see even more states filled out and more service area available for us. So we're pretty excited. Here's a look at our plan designs. This is our third year with these exact plans. We've had a lot of success with these deposit and deductible amounts. So we haven't changed them. I can't say they're never going to change, but as of right now, they are still the same. And they're really great as well because, again, these two plans are available in every single county. So it's not just, it makes it even easier on an agent because you just have these two plans to learn, and that's it. You can sell in a very large service area. So first off, we've got our growth MSA on the left. This is going to be tailored to the individuals who are looking for a lower financial risk. Members in this plan are going to receive a deposit of $2,000. The plan deductible is $5,000. And when you apply that deposit to the deductible, that's what gives us their member responsibility, which is $3,000. Looking at the Growth Plus MSA on the right, this plan is going to be best for those who are really inclined to take on that higher deductible for that greater reward. The deposit is $3,000, the plan deductible is $8,000, and the member responsibility is $5,000. This one's definitely going to be more attractive to returning members who have accrued a balance in their MSA account and have enough funds to cover most or all of their member responsibility. Also, I would say for anyone who is who has HSA funds available, I would probably expect them to go in the Growth Plus as well. Members can also switch between one plan and the other just based on their needs for the upcoming year, and those changes can happen during AEP by submitting a new application. Now let's further explore the value proposition of the MSA and compare it to the long-term value of a Medicare supplement plan. So we're going to look at our growth MSA, and we're going to discuss two different scenarios where one with a member with low medical expenses and then someone who has high medical expenses. So I do want to point out that the Plan G premiums listed here are really being used for illustrative purposes. They're not necessarily going to be accurate based on the area you're in. So I'm going to start with low utilization. So looking at the top left quadrant here, it's going to show that over a period of 10 years, the MSA member is going to receive a deposit of $2,000 each year. Over that same period, a Medicare Supplement Plan G member is paying an average premium of $1,440. Now, without factoring in medical expenses just yet, the Plan G's premium alone over that 10 years is costing just under $20,000. The Growth MSA has no premium, and the member receives a deposit of $2,000 each year, accumulating to $20,000. So right off the bat, you have $20,000 in the MSA, you're spending $20,000 in the MedSup. Next, we're going to move to the bottom left quadrant, and here's where we layer in some of the medical expenses and see what those balances look like. So we account for a $500 spend on average year over year for the MSA. For the Plan G, we took out the 2022 Part B deductible of $233. Now, when we look at the totals, the MSA member expenses are accumulating to greater than $6,000, while the costs for the Plan G are just over $2,000. However, when you take the deposit that comes with the MSA and you apply it to those medical expenses, the MSA member is still ahead almost $14,000 compared to the MedSup member having spent over $22,000. So put another way, after 10 years, the member in the Lasso Healthcare Growth MSA spent $0 of their own money and earned almost $14,000, while the Medicare Supplement Plan G member spent over $22,000 and earned nothing. Now, we know having only $500 per year in medical expenses, it's not always the case. That's definitely going to be your healthier members. So we want to look at someone who has high utilization over that same 10-year period. So everything in the top right quadrant has stayed the same. The only difference that we've made on this side is to the bottom right quadrant. So here we have increased the MSA members' medical expenses from $500 to $5,000. So we have this member hitting their deductible for 7 of the 10 years. By doing this, the numbers rack up to a total of almost $37,000 under the Growth MSA. But when you offset that amount with the annual deposit received, the Growth MSA member spends just under $17,000 from their own personal finances compared to the $22,000 that the Plan G member has still spent. So even with these high medical expenses, the Growth MSA member is ahead over $5,000 compared to the MedSup member. So this site is really, really great. I have a lot of agents who love the layout of this because it just gives you a different way of looking at this plan and really showing that this, can be a very good plan, especially if you're in it for multiple years. And I will say retention in the MSA is very, very strong compared to other Medicare Advantage plans. Here we show the same example, but for our Growth Plus MSA. Don't worry, I'm not going to go over it, but I do want to point out that with the higher utilization and our Growth Plus MSA plan, because of that higher deductible, the value actually falls to the Medicare Supplement Plan. And we want to show that. We want you as the agent to know that. We want, your clients to know that if that's the case, because you need to make a decision. Is the MSA product a good product for me financially? But then you also have to make that decision of, all right, which plan is going to be better? Don't just go for the one that has a higher deposit. It really does take some, further looking and just figuring out, okay, what health or medical expenses do I foresee happening in the future or in the upcoming year? Do I need to have surgery? If so, maybe I go to the lower one because of that. So it's really important to look at the MSA, but then also really look at the plan design from that clinical side. So we already know Medicare beneficiaries aging into Medicare are a good prospect to enroll in the MSA. They're healthier overall, they're going to the doctor less, they're growing their account more, and they're most likely to remain in the MSA for a longer period of time. This takes all of that and it puts it together so you can see just how much extra growth potential there is for someone who enrolled at age 65 versus someone who enrolled at age 70. So here we assume that the member is enrolled in the Growth Plus MSA, which is giving them that annual deposit of $3,000. Then we account for usage and expenses starting at $1,000, increasing to $2,000. And next, and potentially the biggest variable here, is we have this member utilizing that investment option with Optum Financial and seeing a return each year. So starting year one, they took that extra $1,000 in their account and they invested it. And then they continued to invest it and the gains that they had received over that period. Now we look at each of them at age 75. The member who enrolled at age 65 has accumulated over $32,000 in their medical savings account. The member who enrolled at age 70 has a little over $10,000. That's a $21,000 difference and more for the member who enrolled as soon as they were eligible for Medicare. And it just goes to show you, and it reinforces that you need to be looking at the MSA over a period of time and as a financial decision versus year to year for healthcare coverage. The last thing I really wanted to show you is an incentive program that we do have going on. This is something that is currently, we did a version of it during AEP, we're doing another version during OEP, and it's really just to encourage Zing Health MAPD OEP enrollments, but then also Lasso Healthcare ICEP enrollment. So you can get 100 points for every ICEP enrollment that you submit between now and March, and every 300 points qualifies you for a 1,000 piece targeted mail drop. We are using, our lead vendor is Target Leads, and we're pretty excited. We had a lot of people qualify for this for AEP, and we're happy to bring this into the 2023 plan year. So a couple of key takeaways I just want to wrap up with. This product is a must-have for agents. It's going to give you a new product type to offer in your portfolio. It's going to give you that ability to enhance your consultative approach when you're talking to your client. And then it's also going to improve your commission revenue. That's going to be because you have to pair that with a PDP, but then also you can add those additional supplementary coverages to round out that. It's going to be great for many types of Medicare beneficiaries. You've got anyone who is new to Medicare or retiring, investors, anyone that's familiar with an HSA account, which is a lot of people nowadays, your healthy and active clients, your snowbirds, meds, anyone who's interested in a Medicare supplement. And then areas to focus on. So I don't think I actually mentioned this in on my state slide, so that's my fault. But so this is a great product for rural areas where there aren't a lot of other Medicare Advantage product types. We have our highest membership in Texas, Kansas, Wyoming, Montana, and Oregon. So if that doesn't tell you it's a great product for rural areas, I don't know what does. Mississippi is also really high. So really anywhere where there's not a ton of additional competing coverages, and it really any of those states that are heavily Medicare supplement focused states, this is a fantastic option for. And that's all I've got. So John, I'm going to turn it back to you and see if we've got any questions or what's, and let you wrap up.
Thank you, ma'am. There are a couple of things that popped up. You covered a number of them, but one of them that to start from early in the presentation, what if someone applies and it's determined that they're not eligible for the program? What happens then?
So if someone isn't eligible after submitting an application, they're just going to receive a declination letter. If it's during AEP, that's going to give them that ability to go and enroll into another Medicare plan. If it's something that's they still qualify for Medicare, just not maybe the MSA. But it's just going to be a sorry, you're not eligible for our plan type of letter.
And since this isn't applicable to a whole bunch of the SEPs, that's
correct.
neither here nor there because it's that limited time period. Another one that is there is for the rewards program. What if someone doesn't fill out that form when first eligible?
So the rewards program forms can actually be completed at any point within the calendar year. So our 2023 products, our program is going to go out to members here within the next couple weeks. They have until December 31st to submit those forms to us. So even if they already had their annual wellness visit done or had a qualifying activity done, they can manually fill out those forms and provide as much information as possible and still submit them to us, and they will get their reward. So
Awesome.
it's a pretty flexible program.
Awesome. So there's not a time limit. They have to have it done in a week, within a month of enrollment, that sort of thing.
No, no, not at all.
Perfect. Well, I thank you for the presentation. Really appreciate the thoroughness and the concept that has been brought to us here today. I think particularly when we look at a segment of the population that isn't being served by a real, well, gee, I don't want an MA plan type of thing. I don't want a network type of thing. I think this is a great alternative as an alternative within that space. And I think some folks that haven't really been tuned into this segment of marketing, this is awesome. I think it'll work really well for a lot of people. And thank you for the presentation. What I'll do right now is finish up with just a few things as to why folks would want to work with Lasso through Premier Marketing. I'm going to roll through some slides here really quickly. One of the things that we want to make certain that we're able to do is a whole bunch of electronic processing from the very beginning. Now, contracting with Lasso, we're going to do some things directly there. But what Michelle mentioned is this gives an opportunity to do other programs such as the hospital indemnity programs, and completing an agent profile on Sure AC or LC, Assurance Bay, whatever you want to call it, really gives us the opportunity to contract with alternatives within that system pretty quickly and enable us to kick that into play as soon as possible. So it's a great tie-in in that regard for this. What we do offer as well at Premier is discounted errors and admissions coverage for qualified agents. What makes you a qualified agent? Well, you got a contract with us. But this is a program that you own, so it is not something that is like being added to a blanket E&O for just one plan, and then you got to go, how am I going to cover myself with these other programs that I'm offering? And it gives you that latitude of, hey, you're an independent agent. I contract with multiple organizations. I want to make certain that I cover my financial wherewithal wherever it is. And in all honesty, I don't care how big a program is. Premier's huge. We don't offer everything everywhere anyway. So what we want to make certain is we help protect you in that regard, regardless of whom you contract through. We also want to make certain that your license stays in play. So we offer discounted continuing education programs bundled through our association with WebCE, very economical in that basis to keep your license in play. And as an independent insurance agent, you are responsible for your own benefit package as well. This program gets you disability income insurance on a modified guarantee issue basis on which you're paid a commission on yourself. A great way to add to your own benefit package as well. Much as where today's presentation has been recorded, and since Michelle went through a number of scenarios that dealt with numbers, we're going to want to go and review some of this periodically. This gives you the opportunity to do so 24/7, but it also gives you the opportunity to look at how can I present this in different venues, be they live or virtually. And so some of the marketing programs we have in play that are laid out here give you an idea on how you can approach centers of influence within the community, faith-based organizations, other folks that might be a great target audience for presenting Lasso and the advantages that it brings to Medicare beneficiaries. Great way to go in on our website or on our YouTube channel and review them at your leisure. We do also offer access to our electronic tool, Medicare Center. It's a great program that gives you a universal login to multiple quoting engines. It allows you to collect the scopes of appointment and record calls so you remain compliant, and stores them for that 10-year period. And for those of you that have recorded a call, you realize how quickly that adds up space. This is invaluable to help in that area. And it then gives you that opportunity to do that side-by-side plan comparison. It also gives you the opportunity to make use of a presence on the internet through a personal URL. So a microsite that has the programs that you offer available to the public, and what studies have shown us, Deft Research and Kaiser Family Foundation, that many folks coming into Medicare now are doing their homework ahead of time before they contact anybody. And this gives them the opportunity to do so through the products that you offer. You can attach this link to your email or to a website you may have on your own and leverage that enrollment possibility through this website. It also delivers that CRM, that contact management system, so you can do your year-by-year comparisons, stay in touch with your folks, offer additional programs, all the wonderful things that enable you to help drive your persistency, retain your enrollees as well. And it applies switcher tags. So some of the folks that are in your system that may be more subject to a change, well, you're going to know about it. And it gives you then the possibility of making certain that you pay special attention to them. So if they do change, it's with you. Lead Center, we're going to talk about that in just a moment, but this also all gives you the other resources to help sharpen your sales skills. And that's a great way for us to always get better at what we do. We can have a wonderful program like the Lasso MSA. We don't have the proper folks to present it to, or even more effectively, know how to present it in a fashion in which we actually enroll the individual. Well, then we spend a lot of time for nothing, in a manner of speaking, and we want to make certain that we sharpen our sales skills to minimize those possibilities. It is available in a mobile application, and to quote one of the so-called celebrities on television, it's free. You don't have to pay anything additional for the use of the program. Really gives you a lot of latitude to take care of your people and stay compliant and be organized doing it. We do also offer a page on our website that talks about the carrier incentives. So some of the things that Michelle mentioned with the unique programs that they offer to help you with mailings for Zing and Lasso, it gives you that information there as well. Some of those programs with different carriers may qualify you for a trip, and that production may help you qualify for premier incentive programs as well. The mail program that we're going to talk about in just a second, but also the return of our producers convention. It had been on a bit of a hiatus with the pandemic. Hey, it's back. These are top-notch trips that are available to you, and you can see then how you can qualify for that and take advantage of basically a floating vacation in this particular circumstance. We want to help you also get in front of folks with different lead programs. So if you're a Smile and Dial agent, well, we can help provide a contact list butted up against Do Not Call for programs that allow cold calling. I got to tell you, I've taken 14 of those calls personally today, 8 of which think I'm on Medicare, which not quite yet. So we want to make certain that we deliver that to you, but make certain that it is also a compliant program. I mentioned some of the things that we can do with community-based programs. So the retail marketing program, a lot of things that we have with different plans that are out there. Well, in order for it to be appropriate for a retail setting, Walmart or carrier-based program, it has to have that prescription component. When you look at an MSA program, as Michelle described today, well, that's a separate standalone Part D program. So it's a great opportunity to speak to it in this setting. It's also something that you can present to centers of influence in the community, including those faith-based organizations that give you an opportunity to speak live or virtually to their congregation. And this is a great program to explain to providers, primary care physicians and specialists, so they understand the program, and they may well have folks that they feel this is an appropriate match, And so you can generate referrals out of that as well. There are carriers that will generate prospects for you additionally, and there are other lead programs that I'm going to run through here individually in just a second. So starting with the mail program, based on production, it drives down the cost of mail so you can do this consistently. And let's face it, direct mail is kind of like an exercise program. You do it once, you might see a little bit of something out of it, but you feel the pain of the dollars that come into it. You do it consistently, you're going to see the results. And that makes a huge difference for you, particularly in a program like this, where you can qualify for 2 based on production in the health arena and with final expense. And we do so through vetted, preferred lead vendors. So we want to make certain they have systems to deliver those responses back to you in as timely a fashion as possible, so you can reach out to them when they're good and hot. And we also want to make certain that we vet the correspondence that goes out so we stay in compliance. They're not promising half of the Eastern Seashore for a response, that sort of thing. These are good folks to work with great systems, and we want to make certain that we protect ourselves in that area and generate responses. We also affiliate with a program that gives us access to direct mail responses without controlling the whole campaign. And so these are programs that are direct mail responses with folks raising their hand saying, I'm interested in that, and I can use this to fill my calendar. Now, the prices on these do vary throughout the year and by area. It's dictated by supply and demand, but it's a very cost-effective way to fill your calendar throughout the year. The internet lead programs are based on Facebook, and there are programs for both final expense and Medicare. One of the things that I like to make certain that folks realize that, hey, internet leads, that's a pretty microwave response. You turn it on, you can get a lead really quickly, but they expect a response really quickly as well. So we want to make certain that you have systems in play in order to maximize the return of people raising their hands. I had a friend that she got a lead at 2 o'clock in the morning on an internet lead. By 6 o'clock in the morning when she called them, they'd already gone someplace else. So we want to not discourage the use of this by any stretch of the imagination, but we want to be cognizant of the fact that we need to respond as quickly as possible. Lead Center. This is a program through Medicare Center that gives you a way to access leads that are sourced through various means that can be supplied to you either as a hot transfer or as leads going into your CRM program that you can visit and reach out to as quickly as possible. You control the flow, you control the monies that are being dedicated to this, so you can budget for it. And hey, there's even sales on these leads, particularly in certain areas that are of high response and fresh or a little aged, depending upon how you want to work it. A great way for you to have a dependable, consistent lead source. We do also offer free, JJ Walker Talk, access to a T65 locator. Now this goes beyond T65s. This is a program that you download to your smartphone, your smart device, be it a laptop, desktop, whatever it happens to be, iPad, where you register, they verify that you have a contract with us, it's provided to you, you set the parameters of the different programs. So it doesn't have to be just T65s, but it'll map out for you where these people are. So it gives you a geographic sense of where your target audience may be, in addition to supplying that information. The referral program. This is a way for us to cast our bread on the water, so to speak, and take one lead and make it multiply. Through the sales process, we can start asking for referrals in a systematic way as we set the appointment, as we go through the sales process, as we close, as we leave that person's domicile, be it live or virtually. We want to make certain that every lead that comes to you is maximized for your benefit. Now, this goes beyond just the sales process. It's a great way for you to keep your book of business engaged, where you can call in to the folks that are in that CRM within Medicare Center or whatever system you're using and say, hey, I got a great dental program made available to me for folks in your area? Do you know of people that need help in that area? Quiet for a moment, and one of the first responses you generally hear is, well, I need dental coverage. What a great way to engage your book of business and generate leads through just timing and phrasing to generate referrals. We do all this because we want your business. We want you to refer us to your agent friends. And because of programs like the Lasso MSA, which is unique, it's a great way for us to add that to your marketing plan, target perhaps a different segment of the Medicare population than you may have been active with in the past or not, and give you an opportunity to do so in a very timely fashion. So it's like John Wayne in the movie The Cowboys. You know, we're gonna slap a piece of bacon in that biscuit, saddle up, let's ride, because we're burning daylight. That's what we're doing here. We're giving us another opportunity to market effectively with a program that can make a difference for the people we serve. So at this point in time, I'm going to check for questions. We're good. Yeah. Thank you, Michelle, for the very thorough and enlightening presentation. At this time, I want to thank folks that have come on to watch this presentation that have done business with us here at Premier in the past. Thank you for that business. It's greatly appreciated. We hope to deepen that relationship through programs like Lasso. For those of you that are just checking us out, thank you for that opportunity. Hopefully we are enticing you to do business with us, and we look forward to that relationship as well. But for everyone, we want to say thank you for the time that you have invested with us here today. It's your most valuable resource. We recognize that, and we want to make certain that you know we appreciate that opportunity and that investment. And so, until we're able to visit with you again, I wish you good selling. Thanks so very much. We'll talk to you soon.